Good afternoon, everyone. I'm Adam Bishop, CEO of Tag Home Care Marketing. I'm joined here with our head coach, Eric Crump, and we're very excited to be here with you today to present 6 surefire ways to jumpstart your agency referrals in 2012. Very excited about today's presentation. I also want to welcome 220 plus attendees and listeners today on today's call from representing 41 states. We're very excited to have you on today's call, and we really hope that you're going to get a lot out of today's call. We know we've got a lot of great content today that you're going to learn some tried and proven strategies to grow and boost your referrals. So let's go ahead and get started. Our goal here today is to provide you with the maximum amount of results with the least expenditure of time, money, human capital at the lowest possible risk. See, most home care companies today run along what we call the experience and luck curve. And along the experience and luck curve, more than 95% of agencies run along this curve. And the reason why they run along this curve is because they're doing things by trial by error, trial by fire, and they're committing what I call marketing incest. And most home care companies today, and maybe some of you are guilty of this on the call today, commit marketing incest. And what I mean by that is you do what other competitors are doing, copying each other, doing the exact same thing. And that's why most agencies today get incremental results. Increase the referrals by 1 or 2 per month, not seeing any real exponential results. And our goal today is to give you 6 methods and 6 tried and proven strategies to get you on the competitive edge curve to give you exponential results, to take you from where you are today to where you want to be 12 months from now with exponential results, tons more referrals, and achieving your mission goals of where you want to be. It all starts with having a one-page plan. When working with agencies from across the United States and Canada and parts of Europe, we identify one common thread, and that's that most home care companies today don't have a marketing plan. And we're going to give you this tried and proven strategies today on this call, but it all starts with having the foundation of a plan. The reason why a plan is so important is like establishing a target on the wall. Unless you have a target that you can clearly see and identify, you're never going to hit it. And so it all starts with having that target on the wall, and that's essentially what a marketing plan is. I want to demystify what a marketing plan is today, because most agencies think it has to be a 25, 50, 100 page plan that's robust, that contains all kinds of information that you'll never use. And so I want to go and share with you 10 simple steps of really what a marketing plan is to get you started today. See, how many of you would travel from your destination today to across the country without a roadmap or GPS? Probably none of you on this call would do that because you may never get to your destination. It takes too much time, money, energy, and you may never get there. It's the same way with your business or your territory. Why would you run your territory or your business any differently other than to have a clear-cut plan? So let's go ahead and talk about what a plan really is. Up here on the screen, I have 10 simple steps. And that's really all what a marketing plan is. You should be able to take out an 8.5 by 11 sheet of paper and put your one-page plan on this one sheet of paper. And on this example I have up here are 10 simple steps that you need to follow in order to have your one-page plan. The first step is your summary. The summary statement of your one-page plan is what is your goal? What is the target that you want to hit over the next 12 months, either being an agency owner or a sales rep, that you clearly want to hit in order to reach your goal? If you're a sales rep and you want to bring in 50 Medicare admissions a month, or a private duty company if you want to increase your revenue by $5,000 per month, that is essentially what your summary statement is. That's your clear targeted goal that you want to hit over an extended period of time. That's really what step number 1 really is. That's all it is what is your target that you want to accomplish in the next 12 months. Step number 2 is your current market situation. And this is, once again, a very simple step. It's identifying externally to your organization what's happening in the marketplace that's preventing you or helping you reach that target. An example would be maybe some home health companies that have started a new disease process program, or a hospital that introduced a new home health company internally, or maybe a hospital that divested its home care company, or some of your competitors that divested. And so you have to understand what the current landscape is or the current market situation is in order to develop a comprehensive marketing plan. So it's identifying what the external factors are or hurdles are that are helping or preventing you from reaching that target. And then we move to step number 3, and step number 3 is also a very basic process. And it's performing what I call a SWOT analysis. And many of you have probably already done this. A SWOT analysis stands for strengths, weaknesses, opportunities, and threats. A competitive analysis of your top 5 competitors, and then looking at some market analysis that can help you develop greater knowledge on where to go with your overall marketing plan. So when you look at your SWOT analysis, I put up here, and we'll provide these to you upon request, some SWOT analysis templates. And the first template I have up here is your strengths and weakness template. Very easy exercise. These are actual reports that we use in our own home health companies. And the idea here is you look on the left-hand side of the SWOT analysis report, and these are all of the basic variables that you want to determine whether a strength or a weakness for your organization. Starting with the top one, which is a collateral material. Is your collateral material today a strength or a weakness for your organization? Is your office location or your marketing program, is it a strength or a weakness? So you want to go through and identify each of these variables and whether they're a strength or a weakness for your organization. The next template that I've included is the opportunities and threats template. Very similar to the strengths and weaknesses template. Going down each variable on the left-hand side, you determine whether it's an opportunity or threat for your organization. Very basic, very simple procedure, but you have to do this in order to determine what your strengths and weaknesses are and opportunities and threats to move forward on an overall marketing plan. When we look at step number 4, which is your unique selling proposition, your unique selling proposition simply is a simple one statement that clearly differentiates you from your competition. Okay? It's a one statement that clearly differentiates you from your competition. And so we're going to spend a little bit of time in a few minutes going through what your unique selling proposition statement should be or could be. But it's one of the most important things that you have to determine when developing your overall marketing plan. It's that single precise statement that everyone in your organization knows and can articulate to the marketplace, but more importantly, what your marketplace can understand and how you're different from your competition. Very important. So we're going to talk about the 8 unique selling proposition differentiators here in a few minutes. Step number 5 is your service offering or your niche. What is your niche business? What are you known for in the marketplace that's different from your competition? You see, most home care companies, they sell the same service. And in the mind of the referral source of the marketplace, we're essentially a commodity. So instead of being all things to all people, which ends up being nothing to nobody, you've got to determine what your niche service is, or what you're providing in the marketplace that's different and better than your competitors. What are you known for? What specialty program are you known for? Your diabetic program, your orthopedic program, your CHF program, your COPD program. What is it? What program are you known for in the marketplace that you can clearly differentiate from your competition? You've got to establish what your niche is. Step number 6 is your target market, your customer avatar. So once you determine what your niche is and what you're selling, you've got to be congruent with whom you're selling to. So if your niche program is going to be a diabetes program or a CHF program, you've got to make sure that your sales team is congruent in selling to those particular referral sources that are going to refer you the most diabetics or CHF patients. And so it's amazing how many different agencies you work with that when starting out, their niche program isn't congruent with what their sales team is doing in the marketplace. Step number 7 is your objective, and the objective is a restatement of your summary statement. It's what your target is. I have up here an example of what an objective statement is. Want to grow referrals by 25% in 2012. That's the objective. That is essentially what is your target for your agency in 2012 or over the next 12 months that you want to accomplish. And everyone in your organization has to know what that objective is. They have to know what that target is so that everybody can reach it. Number 8, your strategies. Your strategy is how you're going to accomplish your overall objective. So the strategy that I have up here as an example is that we're going to focus on our existing accounts, those existing A accounts, and we're going to increase the amount of referrals that they're giving to us today by 10% in 2012. That is our overall strategy. And the overall strategy is going to help us accomplish the objective or the target that we've established and put on the wall. Number 9 is the tactics. So it's easy for us to say that our strategy is going to get more referrals from our existing A accounts, but what tactics are we going to employ in order to get more referrals from those existing A accounts? That's a differentiator between a tactic and a strategy. So tactics, you'll have many different tactics that will essentially employ your overall strategy of getting more business from your existing A accounts. An example of a tactic up here would be, well, if I'm going to focus on my existing A accounts to get more business from them, what can I do to get more business? Well, the example up here that I have is we're going to focus with those existing A accounts on our new CHF program, or work with our A accounts and explain to them how they could better benefit from our existing CHF program and increase or improve their current outcomes in their patient population. So that's an example of a tactic. And then the final step, step number 10 of your one-page plan, is establishing your budget and making sure that you're reviewing it on a monthly or quarterly basis. Remember that your marketing plan has to be a fluid document. It's constantly growing, and in order for it to be successful and for you to get the return on your investment, you've got to be reviewing it at least once a week with your core marketing team. If you're not doing that, then you're not going to get the return on your investment from your overall marketing plan. See, so many agencies today that they write their plan, they put it into a drawer, they don't look at it for, till the following year. That's not going to be a successful marketing plan. You've got to keep your marketing plan fluid, and up to date. So those are the 10 steps for your marketing plan. This is where it all starts, is having your one-page marketing plan. You can follow these 10 simple steps. I've gone over it very quickly today. There's a lot more to it as far as each aspect, but for an overview, this is essentially what your 10 steps are for your one-page marketing plan. I promised you that I'd come back to unique selling proposition. Unique selling proposition, which is step number 4 of your one-page plan, and by itself is a surefire marketing technique. And all of you on this call have to have a unique selling proposition in order to be successful in today's marketplace, especially with every agency that we work with doing what every other agency is doing and not getting the exponential results. It's because there isn't a unique selling proposition that's being articulated to the marketplace. And so that unique selling proposition, once again, is that one simple statement that differentiates you from your competition. So if you had 15 seconds in an elevator with a physician or a top referral source, potentially, what would you tell that referral source in those 15 seconds that they could clearly understand and how you differentiate from your competition, or how you could benefit them in their patient population? So up here on the screen, I have 8 unique selling proposition differentiators. And these 8 represent a unique selling proposition that you could currently have or that you could develop in your agency that could become a unique selling proposition for you. The top I have listed specialty niche program or service. The specialty niche program or service could be one of the best unique selling propositions that you could develop over your competition. What I mean by that is once you've gone through and done your SWOT analysis and your competitive analysis and you've determined what your competitors are currently offering or what they're not offering, talking to some of your referral sources and people in the marketplace, what specialty program could you develop or have you already developed that have great outcomes or quality measures that could become your unique selling proposition, that you could brand and give it a brand name that could clearly differentiate yourself from all of your competitors in the marketplace? That's one unique selling proposition that a lot of you could very quickly develop. All of you on the call today have specialty programs, but maybe you haven't branded them in such a way that could clearly differentiate yourself from your competition. Some ways to brand them are very simple. Give your specialty program a brand name. Give it an actual name. Instead of calling it your CHF program or your diabetic program, give it a name that you can brand it. Develop nice marketing collateral pieces around and provide clinical outcomes and scorecards for your referral sources that they can see and they have measurable quantifiable data to determine that it is differentiated from your competition. Number 2, your coverage area, your service area. This is also a big differentiator for a lot of agencies. Maybe you have certain specific coverage area that only you cover. Maybe you have office locations strategically positioned in certain coverage area that your competitors don't. This could certainly be a big differentiator for you and a great unique selling proposition. Number 3, your quality outcomes. So many agencies today overlook how important quality outcomes are when marketing to referral sources. We have a very difficult job in selling home care services. We're selling a service. We're selling an intangible. So your quality outcome scores really make the intangible more tangible. So don't overlook your quality outcome scores. Go on to CMS, as Eric will talk to you about in a minute. Look at some third-party outcome companies that can give you real-time quality outcome scores that you could develop into a collateral material, train your sales rep to go into the community, and really clearly differentiate your clinical programs from your competitors based on your quality scores. This could be a huge, unique selling proposition for you. Maybe the size of your agency. Maybe you're the largest. Maybe that you're the smallest. Both have differentiators and advantages over both. The next one, your intake process. Your intake process can be a big, unique selling proposition. When you look at most home care companies today and their intake process, most intake processes are broken. If we were to call 10 home care companies today, we would probably experience some very poor customer service. I think all of you would agree with that. Maybe in your own agencies today, if you were to do your own mystery shopping and call your agency, you probably experience the same type of poor customer service. When you look at referral sources today, one of the biggest reasons why they choose home care companies is how easy do we make it for them to refer to us. And your intake process, if it's easier than your competitors, a lot of times can be this whole differentiator between you getting business and not getting business from your competition. So take a look at your intake process. And how easy is it today for a referral source to refer to you? If it's not easy, make sure that it is easy. Rip it apart if you have to. Make it as easy as possible for your referral sources to refer to you. Next one is your clinical staff. This is another big opportunity that is often overlooked in competitive markets. Maybe you have clinical staff that has certain credentialing or special certification that your competition doesn't have. Position these clinical staff members of your team. Take them out to the marketplace. Introduce them to the market, your referral sources. Have your sales team do some co-marketing with them. It's a big opportunity to really differentiate against some of your competitors. Number 7, your hours of operation. Another huge opportunity for unique selling proposition. When you do your competitive analysis on your competitors, take a look and see what their hours of operation are. A lot of times you'll find that their hours of operation are strictly 8 to 5 or 9 to 5. Introduce extended hours where you have a live intake person on your team that is taking those referrals after hours or on the weekends that can clearly differentiate you from your competition. This could be a big differentiator from you when you've got 80% or 90% of your referrals or 90% of your competitors that are standard hours. When you can extend your hours and provide additional customer service after hours, it's amazing what can happen. Referrals don't stop after 5 o'clock. They certainly don't stop on the weekends. So instead of looking at having an automated attendant or an on-call service, take a look at an actual live person in your organization doing extended hour live intake, and it's amazing what kind of differentiator that can be from your competition. And then finally, technology. Technology is another big unique selling proposition that can position you and differentiate you from your competition. Physician online portals, CHF, modality, technology, telemonitoring programs, and so on. There's a lot of technology out there today that a lot of your competitors don't have or don't currently offer to the marketplace that you could or are currently offering. So, certainly take a look at your technology and put that into unique selling proposition. So listed up here are 8 potential opportunities for you to differentiate yourself and develop a unique selling proposition and articulate that to the marketplace. So here's the final question when developing your unique selling proposition to really help you formulate what your USP should be is most agencies or most of my competitors in my service area provide or offer blank. But what my agency provides or offers is blank. And so this fundamental question really forces you to determine how you're different and better than the competition. And so once you've answered this question, then the challenge is asking yourself, well, can my competitors say the same thing? Most agencies fall into the trap of saying, well, most of my competitors provide candy or muffins or donuts to the referral sources, but what we provide is quality service. Now that clearly isn't a really great example of what a good unique selling proposition is because most of your competitors can say or will say that they provide quality outcome scores or quality service. You want to make sure that whatever you put in there can be quantified and clearly differentiated from your competition. So step number 1 is developing a clear-cut one-page marketing plan, and number 2 is developing a succinct differentiator of a unique selling proposition. Now I'll pass it over to Eric.
Hey guys, thank you for attending today. I want to encourage everyone, if you have questions, go ahead and write them down. Either type them into the screen or just write them down on a piece of paper. We're going to get a little more time than we did in previous webinars to answer some of the questions at the end. However, we're going over this, we understand, at a rapid fire rate. So I just want to remind everybody we're not going anywhere. We're going to be available for questions afterwards and emails. All our contact information is going to be up there to answer any and every question you may have. So again, my name is Eric Crump. I am the Director of Sales here at TAG Home Care Marketing. I'm also the Assistant Head Coach. My specialty is working in the field with specific sales reps and increasing referrals and revenue in both private duty and skilled home health services. Also in hospice services. We're going to talk about all three very briefly. The one thing I want you guys to know is that we understand where you are right now. We understand that there's been a market shift now that we're seen as a commodity. A lot of us are left out in the cold. There's the haves and the have-nots in home care marketing these days. There are the people that get how to actually sell a commodity, and those who are still out marketing, or in other words, explaining to everybody how great you are and how loving you are and how your services can make a difference. Sadly, that's not going to close the deal. So as you'll see in Home Care Basics, the first presentation, and number 3 today, your referral sources will like you. They may even love you. They just don't have a reason to give you their business. So the oddity of home care being in a highly competitive market is we're not used to navigating in a market like that. Quite often, our sales team members report to clinical supervisors, administrators. It's just foreign to everyone, and that's what we're here for. We're here to crystallize your efforts and show you a new pathway. Because our concentration emphasis has always been on delivery of a service that's needed in our market, sometimes going after new business for our agency has always been a struggle, especially in today's market, where, again, there's 2 types of home health agencies out there. They're the ones that are growing and the ones that are shrinking. You can't even hold status quo anymore because of the aggressiveness of certain home care initiatives out in the marketplace. Usually the first agencies in a local service area that embrace true sales techniques are rewarded with a disproportionate amount of new business, referrals, and revenue. I wish I could say that 5 times in 5 different ways, because that's the basic message of today. So today I want you to commit to 3 very foundation basics. If you guys can get these 3 things down, then you can build all the specialty programs, all the initial benefit statements, all the profiling that you want to do. However, if you do not have a firm foundation on home care sales basics, none of those things will return your investment for you. You could throw money at specialty programs. It won't work unless you develop a productivity model where you stop calling your salespeople marketers. Marketing is just being known to the local service area. If you're not known to the service area, there's plenty of great ways to market. Using face calls to market is not one of those ways, however. You want to use your face calls to close the deal. And secondly, I want you guys to invest in some strategy. Too many times we suffer from market fatigue by going to our referral sources, and we have a finite number of referral sources in our service area, but we go to them with the same message day in, day out. After about 4 to 5 of these type of contacts, we're simply ignored. We're not bringing any benefit to these sales calls. I will tell you to let those referral sources rest until you can develop some really unique strategies and initial benefit statements to get their attention. So I always tell home care agencies, no matter whether you're a salesperson, a manager, or agency owner, start out with a successful formula of the right contacts, a stated agenda, a really effective strategy, and know how to close. In other words, don't just take them to the water and let them see the water. You got to be able to push their head down and make sure they're drinking. In other words, you got to close these accounts. 40 face visits in a week is hard work. The secret is not reinventing the wheel with each visit. In other words, we at TAG teach home care sales process of a sales call. You have to lead them toward an end benefit to where they have a reason to stop using who they're referring to now and start picking up your agency. It's just that simple. If you do not give them a benefit message that's strong enough for them to stop who they're using now, they simply won't move. Our service industry is a secondary or tertiary service in their eyes. Most of these are acute care providers or physicians who have the initial greatest effect on their patient population, and we're seen as an adjunct service provider. By that, I mean we got to make our benefits crystal clear. In order to do that, you got to have some kind of a tracking mechanism. So that's why we added that block into your presentation today, and Adam will get into that in detail in just a few minutes. Home care basics is that you're going to call on the referral sources that matter, and you're going to call on enough of them to make a difference. These are ranked in order of current referral sources for skilled services. However, you can take these same 4 major headers and also go out and get the clinical referral sources for private duty services and hospice services as well. The number 1 referral source now, didn't start out that way, but it is now, is acute discharges from hospitals, then specialty physicians, general practitioners and family physicians, and then residential care communities. You need to have a developed initial benefit statement and strategy for all 4 of these sector groups. All 4 of their needs are different. They all 4 make their money in different ways. So that's what we're going to specialize in. We're going to take you through a productivity model where you're calling on enough to make a difference, but you're calling on each one of them with initial benefit. So contacts with physicians and clinicians, often brief and it's on their terms. We must use proven sales technique that lead them into thinking about our desired talking points. However, they are always in charge. I always say if I could teach one thing universally to every home care sales rep out there, it is your approach. You do not rapid fire demonstrate on your approach. You need to approach your referral sources with respect and humility. They're in charge. They're in charge of the patient. They're in charge of the patient's care plan. This goes over to physicians with hospice referrals, clients' loved ones with private duty referrals. I could spend the next 2 hours telling you why a humble approach with an initial benefit statement is the way to go out into the market to sell. Too often we show up and our value message is diluted and our target customers aren't ready to hear what we want them to hear. However, I want you guys to crystallize your benefit statements. In other words, don't just go out there and tell everybody how much you love and appreciate them and you're going to treat their loved ones like family and all that superlative stuff that you can't define. Adam is absolutely right when he says that you have to have concrete, defined solutions for them when you're approaching them with initial benefit statements. So instead of just showing up and saying that you can do a better job than XYZ agency down the street, you could throw out an initial benefit statement as if you're calling on general practitioner, instead of saying, you know, give me your referrals, we'll take good care of them, you could say, let me show you how to add $242 to your practice's bottom line for every home health skilled nursing referral you refer to our agency. That's a definitive benefit that you can show them a pathway on how to do that. Or if you're hospice, you can say, statistically, let me show you how using our palliative care services will add 28 days in the life expectancy of all CHF palliative care patients that you refer to our agency. You can definitely show them how statistically you can make that happen. Or as a private duty provider, you may call on a doctor and tell them with an initial benefit statement, let me show you a program where we can reduce the amount of missed visits and free up your calendar. We'll reduce your missed visits or canceled appointments by 50%. Here's how we do it with our doctor's day packages. You have to have a specific benefit statement when you're approaching these referral sources. So you have your message well defined, have it crystallized into 1 or 2 sentences, and And I always get the everybody's saying the same thing line with a lot of our coaching clients. That's not true. I guarantee you it's not true. I'm out in the field every month making sales calls with different agencies. I'll guarantee you everybody is a generalist as opposed to coming in with specific benefits. So if you allow your referral sources to be the expert, go with a little humility, then you can introduce some very unique selling propositions like annual wellness visits or chronic condition wound care programs or prevention and readmission programs for CHF, heart attack, pneumonia, COP, diabetes, you name it. But you're very specific in the patient population that you're going for, and the patient benefit is going to be the end result. I'm really a proponent of psych nursing. There's a lot of different ways that you could add that major secondary diagnosis into your clinical operations and really grow your business. Or you may partner as a private duty provider with transportation services or visiting physician services. Give us a call. You'll get our information at the end. There's a multitude of new strategies that aren't being introduced out into the marketplace. So I want to end this segment by telling you, guys, you got to have your foundation on firm ground. You've got to be able to target the right referral sources and then call on them in the right number of times. Weekly calls for 8 weeks. I love an 8-week productivity model. If you have any questions about specifics on that, I'd be glad to walk you through that on a separate coaching call. Now I want to give you the fourth of our benefits today. Fourth of the Surefire ways to increase your revenue and referrals is profiling your competition. Not just doing what used to be a SWOT analysis is you make 2 or 3 blind calls into an agency and ask them some questions, and we all did it to each other, so we kind of sniffed each other out as to who was making a call like that. I want to introduce the fact that you can go on Medicare.gov and profile your competition in a way that you've never profiled before using outcome measures. Also, I want you to fall in love with Medicare.gov. The website has so much marketing and selling potential now. It's not the same website it was even 6 months ago. Now it's user-friendly. It's updated quarterly. It's the most recent information that you can get your hands on, albeit it's 2 quarters behind. The latest outcomes and updates for all reporting criteria on Medicare.gov was just updated January 26th of this year. Secretary Sebelius and her team are doing a great job updating this website, and even to the point where it's falling over into CMS.gov website too. In mid-February, they uploaded a whole nother load of community care transition program dates. Now you can submit community care transition programs. That's another great way to differentiate yourself, but those applications can be submitted through June 28th of this year. Demonstrations for money. They're actually paying you back. And when you think about the Patient Affordability Act, I want you guys to understand that they're not profiting off the cutbacks. And in home health, I know we're 3.5%, 4% cutbacks with a few more on the way. But when you consider the physicians' offices, specialty clinics, and the hospitals, they're the big losers in the Patient Affordability Act as far as reimbursements and the way they're changing how they're being paid money from Medicare.gov. So getting back on point, I want to teach you a powerful sales technique where we're going to Medicare.gov and delineating your competition. I always say that there's little benefit in selling down. In other words, do the work it takes to find out who your major competitors are in your marketplace. It does no good to show your services against someone you're already getting the lion's share or more than they are in the grand mix of things. Your opportunity for growth is going to be in either 2 pots. Either you're going to introduce new benefits and new patient profiles that could benefit from home care services, private duty services, or hospice services, or you're going to have to take it away from another agency. You're going to have to show them that you have the better mousetrap, you have the better service model, you actually have a way to save their practice money, time, make it run better. There's something there that has to, in your initial benefit statement, make sense. So when you're profiling your local competing agencies, it's important to stay focused. For private duty services, I always say you need to do the SWOT analysis like Adam covered earlier that covers services, service area, price, specialty programs or services, and employee profiles. In other words, you want to paint the full picture of benefits. As a private duty provider, if you're leading with price, you are wrong because everybody else in your market's leading with price. Have an established price for a benefit. In other words, lead with your benefit. Lead with a morning package. Paint the picture of the benefit that getting your loved one up, getting them dressed, getting them bathed, getting them fed, and supervising your medication, even doing light housekeeping. All those benefits for a single price, say $59. That's a lot better sell. You would no more hire a carpet cleaner to come clean your carpets by the hour than a man in the moon these days because they charge by the room. They lead with the benefit of we're the people to make your carpet the cleanest for this room, air to width for this room or these 3 rooms, here's a set price. You need to start embracing that because again, as Adam noted earlier, we're a commodity now and the first one in the market to beat everybody else into commodity marketing is going to get the lion's share of new business. Most hospice agencies, in my opinion, hospice agencies currently are marketing and trying to close the deal without bringing up obvious benefit. One of the obvious benefit is that certain patient profiles, the longevity of life is increased through hospice and palliative care services. In certain patient profiles and across all palliative care, quality of life is increased. Air to wit, you should be going out there with the benefit of, with CHF, the average life expectancy is increased by 28 days, and they have a better care episode, more satisfactory than with corrective or if they're outside of palliative care services. So I want you to profile hospice agencies by disease-specific end-stage indicators. If they don't have certain underserved patient profiles and specialty programs, that's where you need to start in your development. It's like Adam's first slide up there in the competitive edge. Do not copy your competitors into their programs. Go where they don't go and make underserved markets a lot clearer, a lot more crystal clear. With skilled service agencies, you can go to Medicare.gov and see the 22 reported outcomes that are currently listed on Medicare.gov. These are all quality measures, and to get there, you just go to the Medicare.gov homepage, hover over Resource Locator, go down to Home Health Compare. Once you're there, you're able to make a valid case for continuous referrals being awarded to your agency if you can show a difference in clinical outcomes for certain patient profiles. So you go there, you look up your top 3 to 4 competitors in your market, and you make definitive statements and market against their outcomes. Market for your outcomes. And I always say, if you go to Medicare.gov, you can make these creative comparative flyers and call on, and you're going to take away patient populations from clinical referral sources one piece of pie at a time. And that's how you would do it, by one disease-specific patient profile at a time. So if you were to compare 3 different home care skilled service providers, you could go to the quality of patient care pages, and underneath all 5 of these major headers, major service headers, managing daily activities, pain and treating symptoms, treating wounds, preventing harm, and preventing unplanned hospital care, you would pick out where you have a distinct marketing advantage. This is one place that is recognized through all genres and all referral sources as the definitive answer as to whose outcomes are more complete, because in all honesty, you're reporting these numbers yourself. So uploaded is a preventing unplanned hospital care. If you can make your case that by a hospital referring you a patient, that they can cut their own reimbursement or readmission rate, in half then you're going to make them real dollars. We'll find out more about that in the upcoming class. I do want to bring to your attention the urgent care new reporting criteria that's up on our clinical outcomes. There's a reason why that's there, and hospitals know it, and we need to know it, and that is efficiency modeling. We're going to get into efficiency modeling a little bit. That is the cutting edge of home care sales reps' talking points right now. You can show them where you can guard 20% of their current Medicare reimbursement starting when value-based purchasing hits on October 1st, 2013. It's the single most effective way we can preserve their current reimbursement. So we could and should learn all about our competitors and their clinical outcomes on Medicare.gov. I just want you guys to know this is not a horse race. When you go to these sites and you're making your collateral, do it judiciously. Do not, if you don't have but a slight edge, I suggest that you look in other places. It's better to paint the picture of patient benefit than to turn it into a horse race, because remember, these numbers are updated every quarter now, and I've seen some big swings come through in some of these reporting criteria. So another area you can go and look up is the services provided. Clearly, Gentiva would have a distinct advantage in this specific market over DHEC services and interim healthcare because they provide both speech therapy services and medical social worker services, where the other two clearly do not. My suggestion is that you create a matrix of all favorable outcomes and get your talking points really crystal clear and arrive with that initial benefit statement. I teach sales approach and how to go through this process of a sales call. It starts by having a powerful initial benefit statement and then interviewing your referral sources and then showing them your specialty programs. So in that order, Medicare.gov is the industry standard. There's a lot of stuff here to go over. I could spend the next 4 hours with you just on that site alone. However, I'm going to turn it back over to Adam for the 5th segment in our 6 surefire ways to increase your referrals.
All right, thanks, Eric. I know we're moving along pretty quickly here, but we've got a lot of content, a lot of information to get through to you in probably less than 60 minutes. This information is probably a 2-day seminar, and I'll talk about that later on, but we're moving pretty quick. Moving to step number 5 is contact relationship management. Just to be very blunt, if you currently today don't have a CRM, electronic CRM, or market intelligence data, you're really behind as far as the competition. And what I mean by that is that CRM today, when we look at our marketplace, highly sophisticated marketplace, lots of different referral types, and different continuum patterns that are happening, it's almost impossible for a successful sales rep to keep track and manage their day-to-day activities, and for a sales manager to keep track of this information and manage effectively and efficiently without an automated CRM contact management tool. In addition to that, data that is available to us today from several different sources provide us with intelligent market share information that give us referral patterns of physicians and hospitals, and competitive analysis reporting of your top competitors, where their business is coming from, and with a decile ranking of how much business is being provided from a hospital or physician to your top competitors. This data is available to us today. And moreover, this data is available to us today inside of a CRM, which I'm going to show you here in a moment. And unless you're using a tool like this today, you're really going to be not as competitive in the marketplace as some of your competitors may be employing this kind of technology and utilizing this data today. So when we look at a CRM today in the marketplace, some of the benefits to you are having more focus and sales strategy. And instead of having that trial by fire, or as I talked earlier, committing that marketing incest, you've got to know what your reps are doing. And if you are a rep, you have to know what's going to make you more efficient and effective on a day-to-day basis in your marketplace. It's too difficult to manage 100, 150 referral sources in today's marketplace with multiple referral streams coming in. So in order to be able to focus your sales strategy, you've got to be able to automate those activities. maximizing your sales and marketing ROI. You've got to know where your referrals are coming from. You've got to know where to allocate your resources and your expenditures in the marketplace to get that return on an investment. And without a tool or a contact management system, it's almost impossible for you as a manager or for a sales rep to determine where your referrals are coming from and where best to spend your time. Increasing your sales efficiency, knowing where to go, when to go, what you're going to say, how to win that referral, how to effectively get through the sales process in the least amount of time and money. It's almost impossible to do that unless you've got an automated tool to be able to walk you through step by step on how to do that. Increasing your market share. Increasing your market share, knowing where your competitors are getting their referrals, knowing what your competitors, where they're going and how they're getting those referrals and how much referrals are they getting each and every month, so that you can develop strategy and different tools and techniques in order to increase your market share over your competition. And then more importantly, looking at hidden pockets of opportunities that exist that maybe you've overlooked or your sales team's overlooked, positions that you currently aren't marketing to that have high decile rankings for referrals, or hospitals that have high decile rankings for referrals that we've overlooked. And this has happened to many successful sales reps and owners of agencies, where they get caught into a pattern of calling on the same referral sources day in and day out and overlook these hidden pockets that exist today. And so with this data that is available to us today, that can be brought into a contact relationship management system that can give you and your reps pinpointed referral source contacts where they should be spending the majority of their time instead of focusing their time on the lower decile rankings of referral sources. And then, looking at physician and facility referral volume. This is very important to be able to budget and forecast and where your referrals are going to come from month to month. Not just relying on your existing referral sources that are bringing you business, but looking at new referral source opportunities that currently aren't giving you business, or at least not as much. Or looking at your existing accounts and your contacts and referral sources and determining that you're only getting a small percentage of the total business that is actually could be provided from those referral sources based on this data that is now available to us. So here are a couple of screenshots. I'm not going to get into these today, but looking at having an automated schedules that can be managed by the rep in the field on tablets, overlooked by your sales manager. Looking at the next screen I have up here is our Target Watch module that has been built into our Playmaker CRM system. Here you'll look at the screenshot where you have various decile rankings of facilities. This data is also provided by physician. So in a certain service area, you could filter it down, determine what facilities or physicians are providing how many referrals by decile ranking, by disease state, and so on. There are targeted mapping technology built into the application where you can pinpoint and drill right into which areas and which counties and zip codes you should be calling on more aggressively and per referral source. Looking at your contacts, keeping track of your contacts, knowing exactly what your pre-call and post-call plannings are for each of your contacts, so that your calls are more efficient and more effective on each and every call. Some other benefits that are built into the Playmaker CRM system is the compliance module. I know today there's a big initiative for physician marketing compliancy, and we're going to see more and more of this in the years coming, where we have to provide greater documentation. It's going to be over and above the 355 Stark 2 ruling, but we've got to provide more compliance reporting for our marketers in the field. This tool provides one-click technology that provides instant reporting and alerting to management on expenditures that are over the $355 allotment. There's also a one-click expense tool. We know that a lot of our reps spend a lot of time in the marketplace today. Instead of being face-to-face with referral sources, they spend a lot of time on sales and marketing reporting and expense reporting, when Playmaker allows with one-click technology to eliminate a lot of that time with reporting, both in expenses and sales and marketing reporting, so they can spend more time face-to-face with referral sources. Also, another great benefit to Playmaker CRM is having a sales zone. A sales zone essentially is a sales pathway with the best practices that you can build in throughout your entire organization, so that you know that all of your sales reps and marketers are employing best practices on your referral sources. which ultimately are going to lead to quicker sales cycle and greater referral volume for your organization. So if you currently are not employing a CRM today or utilizing market intelligence data that I've talked about very briefly with regards to physician and hospital data, and you're not aware of how much business is currently out there for physicians and facilities, then I absolutely am going to encourage you to talk to us more about the opportunities that exist for your agencies so you can become more competitive in the marketplace and obviously increase your market share over your competition.
Thanks, Adam. Now we're going on. Step 6 is we're going to give you a sample of how we teach individual sales strategy here at the university on site with training. This is a 2-hour class that I'm going to rush through in about 9 minutes. However, I hope you get some benefit and keep up. I do want to encourage you to write down your questions, start typing them in if you get a moment, but give me the next 9 minutes of your undivided attention. This is probably the most important thing that you could hear. But remember, this is one referral source, hospitals. We teach courses on specialty clinics, general practitioners, residential care facilities, ALFs, ILFs, SNFs, and community marketing. All those are packaged in. We have a 3-day camp. We're going to get to that in a little bit. But right now, I want to shift your attention to profiling hospitals. They're probably 82% nationwide in post-acute discharges is where skilled services, skilled home health services are picking them up. However, I want you guys to remember, with private duty services, I can show you a strategy of back-end patient scorecards where you can be an adjunct care provider in a lot of these strategies. And of course, palliative care episodes and palliative care services are going to greatly benefit the hospital if you approach in a benefit message where here's how we're going to reduce your in-house mortality rates. And we'll get to those in just a second. I want to spend what time we have profiling hospitals with skilled services and therapy in mind. So if we shift our focus to one of our major referral partners, I want to go to Medicare.gov again and go to the home page, go in the resource locator, and this time go under Hospital Compare. Once you start comparing your local service areas hospitals, you can find out a host of great information. I want to warn you not to use this as an excuse. Do not use that the hospital has their own home health agency. The national average for self-referrals is only around 50%. Someone else is getting those 8 to 10 referrals a day that's coming from your local hospitals. You got to keep going there with the benefit message. Show them how you got a better mousetrap to go in and take some discharges from these major referral sectors. You'll find out how many Medicare payer acute hospitals you have, how you can modify the results to add or subtract, even map local hospitals. So when you go to Medicare.gov, reported outcome information on specific hospitals, we're going to spend some time there. I can show you on a coaching call, you can do a mathematical formula, come up with during the reporting period, how much money did this hospital make or lose on certain DRGs or diagnosis, disease-related groups. That's how they're reimbursed from Medicare.gov. So we can take it to the point where you can show up at a discharge planner, and instead of being directed to the lunch book or to the cubicle to leave your brochure or to sign in where you're going to provide their whole staff CEU credits, you just show up and say, for this one diagnosis, for this one DRG of pneumonia, I can save this hospital $242,000 a year by reducing the readmissions back into an acute care setting. That's where I want to take you. You need to know about all the hospitals in your report and their reported outcomes. In other words, just like the matrix in your SWOT analysis of your competitors, I want you to make a like matrix analysis of area hospitals, find out where the greatest needs, because you'll be surprised at the varying needs with different hospitals. If you go on Hospital Compare, you can compare up to 3 at a time. I would suggest that you narrow your search in whatever your service area is through general information search engines, but you can find out how many acute care hospitals. Now, acute care hospitals are the ones that are going to suffer the penalties that are coming up for readmissions and also efficiency models. We're going to get into that in a little bit, but in your critical care or rural hospitals, they are not going to be penalized, and VA hospitals and children's hospitals are exempt as well. So you want to concentrate on your acute care hospitals. You can compare up to 3 at a time. You'll be redirected to specific hospital CHAPS scores, and that's their patient satisfaction surveys. They're currently 30% of their reimbursement, and their process of care, what they intend to do for the patient, is the other 70. That's how hospitals have always made their money. So they've always concentrated on HCAP scoring, patient satisfaction surveys. So if you go to a discharge planner right today and say, where are you having problems with certain questions? There's 10 questions, profile questions on HCAP scoring. Because I'm going to see this patient for the next 60 days, I can reinforce the problem areas that you may have on your patient satisfaction surveys. That's a great sales call. You're automatically going to affect their bottom line. Now, HCAP scoring is going to be 30% when value-based purchasing takes over now, but any assistance you can offer into their patient satisfaction surveys, and I know in skilled services we're just getting used to having these patient satisfaction surveys scored on ourselves, but any assistance you can get in that area is greatly appreciated. So there's what it looks like when you go to Hospital Compare. That's an actual look at the survey of patient hospital experience, HCAP scores. I want you to see on this slide where all the search engines are to the left. See that process of care measures? Process of care measures are 6 specific measures in which represents 70% of a hospital's reimbursement from Medicare. And make no mistake about it, Medicare is their big payer source. All the private Advantage care plans and private insurance have whittled down to the point where they're subsidizing all those private pay care plans with Medicare patients just like we do. It's very important to them, their Medicare population. But you can go over to the left and see the process of care, outcome of care, use of medical imagery, survey of patients, HCAP, patient safety measures, and Medicare payment and volume. Those are all separate search engines. Now I want to bring up how their Patient Affordability Act is changing the mix of the payer hospitals. Payer hospitals for Medicare Direct are going to be paid on outcome of care more than process of care now. In other words, it's not your intent that we're paying for anymore as a Medicare taxpayer. You're going to pay these acute care hospitals for their actual outcomes, the result of their care. So that's a big shift, and hospitals are scared to death. But right now, they're all being reimbursed just on process of care, their intent, and HCAPs. But starting with value-based purchasing, which starts fiscal year 2014, that's October 1st of 2013, they're going to break out. And in addition to clinical process of care and HCAP scoring, they're going with patient outcomes and efficiency models. There's great opportunity to sell to local hospitals under this. Now, this is probably the most important screen that you'll ever see with hospitals as a home health provider, even hospice and non-skilled private duty provider. You see where they're now on 12 measure counts, and it's 70% of their reimbursements under process of care. And those HCAPs or patient satisfaction surveys are 30. Starting October 1st, 2013, that changes, and there will be 13 measure counts for process of care, but it's only 20% of their reimbursement. A full 50% of what Medicare pays hospitals are now going to different reporting structures. And they are, HCAP stays the same, outcomes of care measures and efficiency models. Outcome of care measures are divided into 3 different categories: mortality rates, hospital-acquired conditions, and under AHRQ, that's your readmission outcomes. And your readmission outcomes would only account for 3 of those 13 reported measures. So everybody, rightly so, is approaching hospitals with the advantage of knowing that our readmission rates back into an acute care setting for 30-day readmissions for cardiopulmonary diagnosis of post-heart attack pneumonia and CHF accounts for 3 reimbursement measures of 13. However, everybody's ignoring efficiency modeling. Now, let me show you what efficiency modeling means. It's one measure, and that's it. That's it on the screen. It's one measure of 20% of their reimbursement. Efficiency models will mean just as much to hospitals as what they've always concentrated on, their process of care measures starting October 1st of 2013. And quite simply, it's a peri-acute episode. How often can they pull off a successful efficiency modeling of having a doctor's order before an acute care episode, and then after the acute care episode, managing for 90 days post-discharge with visits once every 30 days back to their primary care physician. Now, on the right side of an inpatient stay, there's only two options. Either home health is directing those 90-day post-discharge visits and making that efficiency model happen, or they're in a rehab center, and supposedly we can start using home physician models and other things, but primarily this is your advantage. Home health can take over the 90 days post-discharge and show them that you can complete the cycle on that efficiency modeling, because they're going to be judged not on if they can do it one time on a patient, but how many times out of 12. What's their count measure out of 12 consecutive acute care episodes can they make efficiency modeling work? You're more important now to hospitals based on efficiency modeling than they even realize. But you can go to them and specifically say, because of their outcomes of readmission rates, which is another, remember there are 3 of 13 reported outcomes, that you can save them specific amount of money per readmitted patient. So a quick view of a 30-day hospital readmission rate would break it down between heart attack, heart failure, and pneumonia. And you can see whether your local profiled hospitals and where they fall in the national average. Always go to view graphs, so it'll give you these numbers. You can actually take the numbers of discharged patient per reporting period, multiply it by the number of, that is their readmission rate, and come up with a specific amount of patients. You can even take it a step further, ladies and gentlemen, and tell whether they're in the bottom 25 percentile or where they need to go to be on national average. But you can also find their average reimbursement by DRG by going to their patient payment and volume search engine. So all that's gone over in our classes. I know I spent 9 minutes on a class that takes 2 hours, and I apologize for that, but I'm not going anywhere. God willing, I'm going to get over this little bit of flu, and I'm going to come back stronger than ever and answer all your questions. Now, I want you guys to know that we've covered these 6 things for you. We have a way, and we'll send you out templates where you can make a one-page marketing plan. We'll help you develop a unique selling proposition that is unique, and you can go out there in the market and no one else can say. We gave you some hints on what some of those could be. Home care sales basics. I love productivity models. We don't call them the right people often enough. Just making that change and getting your foundation underway will make have a drastic effect in your referral and revenue numbers. Then profiling your competition, how to make that matrix, how to go with your value-added message. You have to use underlying CRM. Playmaker's the best in the business. It's the only CRM out there that you could have access to a home care sales coach. In other words, we don't just track various points into the CRM. We show you why they're important. We lead you in the direction of that you can be the most successful. And then profiling hospitals is the tip of the iceberg. We rush through it. This is a 2-hour class. I'd welcome for you to leave and have all your hospitals, all your specialty clinics, all your general practitioners, all your residential care communities, all in a program, a true marketing program to leave tag and hit your market running. I'm going to hand it back over to Adam for some special announcements.
Thanks, Eric. I think we should have called this program the 6 rapid fire ways to grow your referrals, because certainly we rapid fired these techniques over to you, and but I really hope that the listeners on the call today, that you all got some nuggets and can take them back into your marketplace and start employing them very quickly. If you're serious about growing your referrals and growing your market share and growing your business, then I encourage you and your sales team to attend our brand new Home Care Sales Mastery University, located here at TAG headquarters in Nashville, Tennessee. You'll get 3 full days of intense home care specific and sales and marketing that'll transform your business. By attending Home Care Sales Mastery, You'll compress years into days and saving yourself months or maybe even years of frustration and failures and get the answers that you've been searching for. Some of the things you'll discover: best practice sales strategies, physician and facility selling strategies, community marketing and sales techniques, outcome and specialty program selling strategies, transition care and community-based organization strategies, territory and account management techniques, and so much more. That's just the tip of the iceberg of what you'll experience at TAG Home Care Sales Mastery. There's a ton of information that you'll capture while you're here. The next event that we have is March 21st through 23rd. The last two that we've had have been sold out. This one here is very quickly selling out as well. We only have 6 spots left, and so I would assume with the amount of callers we have on today's call that those 6 spots will be gone very quickly. Some of the other things that you'll get by attending, in addition to the sales strategies, is you'll also get an annual membership onto our online university featuring weekly and monthly sales and marketing strategies and marketing templates, tons and hundreds of marketing templates that are available to you, a 60-minute monthly group coaching call, a 30-minute monthly one-on-one coaching call with one of our coaches. You'll get our home care sales marketing PowerPoint manual, 15% discount off any of our products or services in our booklet. You'll also get a free tablet, a tablet PC that will download Playmaker CRM onto, and then you'll also get a day of training on Playmaker while you're here as well. So the idea is that when you leave here after the 3 days of intensive training, home care sales training, as well as contact management training through our Playmaker system, you're going to leave here with the intelligence and the market savviness to go back and essentially dominate your marketplace. We've been doing boot camps for 10 years, and we've revised this university beginning of this year. We've incorporated the best and the latest strategies in home care today, and have incorporated the technology and the market intelligence data to give you the leading and the cutting edge over your competition. And so I encourage any of you on this call today that are looking to grow your business, to take market share away, increase market share, increase profitability. If you've got a couple of new sales reps that are new to your organization, or even tenured sales reps that you're looking to give the competitive edge to, this is the place to do it. So right with that, I'll leave it up to you to make that decision. This is probably the best 3 days that you'll have working on your business as opposed to in your business. And now we'll open up the lines for any questions.
We have a few questions, Adam. And guys, I encourage you to type in your questions now. And be sure and also write down this number now. You can reserve your spot for our Home Care Sales Mastery University for March 21st. I think there's a couple of inquiries now, but when we started this presentation, we had 5 seats left. I'd love for you guys to come and spend some really quality time with us. You can't get a better return on investment than training your staff and coming up with new strategies to implement in your local service area. As promised, I'm going to go over some of the questions that have come in so far on the webinar. However, keep typing them in. We're going to get to as many as we can. We're going to spend about 10, 12 minutes on questions now. So I have a question about the CRM and where the numbers come from. The numbers are part of our Target Watch CRM program. You can target local facilities in their patient profiles or discharge profiles, as well as physicians. And yes, they're real numbers, and yes, you are going to be amazed when you come in. So when you tie in the basics and the productivity modeling with the fact that you're calling on the exact right clients, it's going to make a big difference. Here's another question, Eric. My guys can't close the deal. What's wrong that everybody agrees that our services are just as good as anybody else's? It goes back to those home care basics where you got to give them a reason to do something different. They're not just going to, on their own, change who they're using now. Remember, we're a secondary or tertiary service in their eyes. We have to draw out the benefit and then hold them accountable to their promises. One of the biggest shutdown statements or objection statements that we see in negotiating with referral sources is that they promise the next referral source. But we don't take it to the next level by making sure we know the exact patient profile, the exact patient discharge date, and hold them to the specifics and call them out when that next referral source doesn't come. Too many reps are returning to their offices saying, yeah, we're going to get a lot of business. They promised me. Promises are as empty as the words unless you can hold them accountable with specifics. Here's another question. Do we have much experience helping startup private duty agencies get off the ground? It's one of our specialties. You can go from 0 to 100 miles an hour and pass the vast majority of the home care providers that are still drawing on images of puffy clouds of joy and how you love your patients like you love your grandma. I'm going to tell you that you can go to clinical referral sources and even loved ones now. It's a different market. Private duty is a different sell than it was 3 or 4 years ago. You have to show the benefit. You have to show that you're able to accomplish certain tasks that are needed in the home for a set price, and you can do it not just one day, but you can do it every day. But that's what you do. You're in the service industry. Yes, we can help you start up. What's the formula to calculate loss based on readmits? What you want to do is go with the stated average per DRG of the cost of care for these acute hospital settings. In other words, in the community care transition program, and by the way, you guys, if you're not involved in a community care transition program, it's not too late. Give me a call, but you need to get on the bandwagon. There's not enough people applying for those and being accepted, so they extended the dates all the way. The first dates ended in October, but they've got new dates up there that go all the way to June the 28th now. However, due to those applications for demonstration of care transition programs, they put a lot of collateral data up on CMS and Medicare.gov. For instance, the average cost of care for an acute setting on a readmitted CHF patient is now being reported as $9,600. You can go and cost average that DRG under the Medicare payment and volume search engine and figure out how much your local hospitals are getting for those discharges. Subtract the two, and that's how much money they're losing on every CHF readmission before value-based purchasing. You start adding outcome measurements and efficiency modeling into those readmission numbers, and a lot of your community hospitals, it's estimated that 1 in 20 in major metropolitan service area acute hospitals are going to go out of business because they don't understand the veracity in which Medicare is going to drop the hammer down. So the formula to calculate loss is based on DRG. It's a series of calculations, but you can easily make it. We teach you how to do it here at Home Care Sales University. Another question, can we have the slides? We get that a lot. Of course, you can have the slides. Not only can you have the slides, you can have a free coaching call. You can have all the templates, and we'll send you the templates for the SWOT analysis and the 10 marketing plan templates that we promised. Nick, our marketing director, just slid me a piece of paper. We have, it looks like 4 spots left, so call now in our Home Care Sales Mastery University. It's 1-866-232-6477. Just ask to be put on the list. We'll hold a spot for you until the end of the day if you need to get, but it's first come, first serve. It's always been that way, unless you're in a competing market, which we will tell you. We don't bring in competitors into our Home Care University training sessions. We have just one provider per service area. So here's another question. Most home care agencies offer the same services. How do you make yourself stand out after comparing your agency with other agencies? You have to make it based on money, patient exposure, or patient benefit. It's quite simply those 3 things, but you have to draw a distinct picture. Whenever you're calling on a clinical referral sources, you can't just leave it at here's what we found, so here's what we came up with. And most people don't even go correctly with that. mentality. They say, oh, I think I'll come up with a orthopedic program, and then they go out in the market and find out nobody in the market's interested in a new ortho program. However, if you interview properly, come up with a great program, specialty program, you still have to draw out the end benefit. By using this prevention and readmission of pneumonia patients back into XYZ hospital, your average cost for choosing us as a post-acute care provider, your average cost savings would be $143,000 a year. You can make those statements, those initial benefit statements. But also, like I said before, you can make specialty programs for hospice where you're coming up with some of the National Hospice and Palliative Care Organization studies where you can add life expectancy to certain patient profiles and diagnoses. You can come up with patient scorecards and increase patients reporting, back-end reporting as a private duty provider to these post-acute patients, but also show them where you can reduce their amount of missed visits back into their practice for chronic care patient visits. Coming up with palliative care patients and mimicking what hospice does in the mornings, you could do that in the evening. There's a host of different unique selling propositions that you can come up with. But if you're waiting for a limb to fall out of a tree and knock you in the head for a good idea, I suggest you call in 1-866-232-6477. I'll give you 5 good ideas, right? I'll lead you in a direction of need, because we hear from marketing agencies and home health providers, hospice providers, private duty providers from all over the country. So we have our pulse on the industry pretty well. So some more questions. Where did you get those screenshots from Medicare.gov? You go to www.medicare.gov, and I can teach you how to go to different screens and different search engines, show you what they mean, pull them out, so you can start. Your home care sales reps can, instead of coming to you and saying they're going to buy a lunch for 50 people to get some FaceTime with the hospital unit, just to let you know, I've spoken to 3 different hospital chief medical officers representing agencies, just merely showing them how I can save them money. It's far better message to provide them hundreds of thousands of dollars versus Subway sandwiches. Would you consider just doing the profile of hospital class as a webinar? Yeah, I do that. But I do that at Home Care Sales Mastery University right here in Franklin, Tennessee, right on the banks of the Harpeth River. I do it about once a month, and I'd love for you guys to come. But yeah, and we do on-site presentations as well. But I really think, and we always offer this, is common knowledge. No one has ever asked for a penny back, but we give a money-back guarantee. If you're not satisfied when you leave one of our university training classes, no one's ever taken us up on it, guys. And you will see that if you go online, we have testimonials out the wazoo of satisfied clients. It's just that you have to go out there and you have to initiate it in your local service community. Got a lot of well wishes and really gracious things that are coming in under the comments. We appreciate that too. We're going to end the webinar. However, we are going to answer all the additional questions that come in. We're going to leave up our contact screens for the next 5 to 10 minutes, so you guys will have plenty of opportunity to write all this stuff down and also write in your questions. Nick, let's go back to mine and Adam's email addresses. There you go. I'm looking at one screen and talking about another. So guys, you can contact us through any of this contact information. We're going to leave it up there for the next 10 minutes. We really, in all honesty, appreciate the care and service you give to all your clients out there, and we are very honored to play a small part in growing your revenue and referrals for all you agencies out there. So don't be strangers. Give us a call, and thank you for attending today's webinar. Good luck.